Thank you very much, sir, for invitation. Today we are going to talk, as sir said, about Key Link 010 study, which is open label randomized trial about Pembrolizumab plus Olaparib versus Abiraterone or Enzalutamide. Next slide, please. Hello. Yeah. Next. So in this study, key eligible criteria were histologically or cytologically confirmed MCRPC cases, patient who has progressed on either Abiraterone or enzalutamide, but not both. So either of drug patient, if taken, then we can taken into consideration for this study, or patient also taken docetaxel for primary treatment. ECOG performance status was 0 or 1, and tissue sample for biomarker assessment. Stratification factors based on either patient has taken Abiraterone or enzalutamide, and any measurable disease at baseline present or not. So ratio were divided into 2:1. 529 patients were taken in Pembrolizumab arm. Pembrolizumab is given up to 35 cycles maximum, and in Abiraterone or enzalutamide arm, 264 patients were taken. Dual primary endpoints were radiologically progression-free survival and overall survival. Secondary endpoint were time for first starting of treatment and overall response rate and safety. Next slide, please. So baseline characteristics and patient are almost similar. 54 patients are in Pembrolizumab group are has taken Abiraterone, and around 54 same patients has taken previously same Abiraterone. Enzalutamide is 45% of the patients. In majority of the patient, Gleason sum score was greater than or equal to 8, which is 69% in both arms. Other, we will focus on BRCA status and PDL1 status. BRCA mutated patients were around 9%, and non-BRCA mutated patients around 83% in Pembrolizumab arm versus 78% in any hormonal treatment arm. CPS score, PDL1 CPS score less than 1 in 69% of the patient of Pembrolizumab arm versus 74% in hormonal arm. CPS score more than equal to 1 in 24% of the patient in Pembrolizumab arm. Next slide. So primary endpoint in this study was progression-free survival, radiologically progression-free survival. In Pembrolizumab plus Olaparib arm, median survival months was 4.4 months, whereas in hormonal arm, this median survival months was 4.2. So these are almost similar. There is not much changes, but we can see that in patient with BRCA mutation, which is ratio is more favorable in Pembrolizumab arm because of Olaparib. We generally used Olaparib in BRCA mutated patient, and this progression-free survival is more effectively we can see in BRCA mutated arm as compared to non-mutated arm. Even in PDL1 status, CPS score less than 1 has less favorable factors as compared to the CPS score greater than equal to 1. Next. So primary endpoint based on overall survival in Pembro plus Olaparib arm is around 15.8 months, whereas in hormonal arm around 14.6 months. So this is again largely similar. And hazard ratio, when we see it is more favorable in BRCA mutated arm when we see Pembrolizumab plus Olaparib arm as compared to non-BRCA mutated status. And in PDL1 high status, when CPS score is greater than equal to 1, hazard ratio is more favorable for Pembrolizumab arm. Next slide. Secondary endpoint. When we see secondary endpoint, median months is 7.2 for Pembrolizumab arm as compared to 5.7 in hormonal treatment arm. And in majority of the patients starting for the second line treatment, cabazitaxel or enzalutamide, Abiraterone, carboplatin or docetaxel. These are the subsequent lines of the treatment that has been used. Next slide. Secondary endpoint, overall response rate. When we see overall response rate in pembrolizumab arm, it is clearly much higher, 16.8% of the patient as compared to in hormonal arm around 5.9%. DCR is again higher in pembrolizumab arm, 32.4 months as compared to 19.3 months in hormonal arm. Here we can see this complete response in C is seen around 1.6% of the patient. When there is where there is none of the patient gets complete response with hormonal treatment. In day-to-day practice, when we use immunotherapy, we generally see such kind of magical response in 1 or 2 patient out of 10 when we treat with immunotherapy. So similarly, we can see this finding here as well. Partial response even seen in 15% of the patient in pembrolizumab arm versus 5.9%. For stable disease seen in almost similar percentage of the patient. Next slide. Secondary endpoint, safety. In pembrolizumab arm, obviously we can see higher rate of the adverse event because of a majority of the side effects are related to Olaparib. Around 57% of the patient develop more than equal to grade 3 disease, grade 3 adverse event. In hormonal arm, around 39% of the patient develop such kind of the adverse event. This adverse event led to discontinuation of the treatment in 15% of the patient in pembrolizumab arm, as compared to only 3% of the patient in hormonal agent. And death related to treatment seen in 4% of the patient in pembrolizumab group as compared to 2.3% in hormonal group. So we can see this Olaparib arm has more side effect as compared to hormonal treatment, and the majority of the side effects are anemia, fatigue, nausea, and decreased appetite. We generally see that Olaparib patients have more fatigue, and which is very difficult to treat and counsel the patient when patient is on Olaparib. Next slide. So conclusion of this study is in majority of the patient, primary progression-free survival and overall survival in pembrolizumab arm and in comparator hormonal group are almost similar. But when we see overall response, which is higher in pembrolizumab group as compared to Olaparib, and this study is has more adverse event in pembrolizumab arm, and majority of the adverse events are related to Olaparib. Other ongoing studies are also there, like with different combination of pembrolizumab and Olaparib in various prostate cancer. Thank you.
Thank you, Dr. Bhatt. And unfortunately, this combination of immuno-oncology drugs plus the PARP inhibitors was a negative study. And at the outset itself, it enrolled unselected patients. And most of these patients were heavily pretreated. So probably that was one point which was against it. And even if you look at the biomarkers, about 30% of patients were the ones which had PDL more than 1. And if you look at the flip side, the BRCA positivity was just, I think, 8 or 9%. And so was the HRR positivity, which was about 25%. So even if you add both of them, 25 plus 9, say about 35% patients were the ones which had the biomarker assays positive, and 65% were negative. And the 70% of patients were PDL1 less than 1%.
Yeah.
So probably that was the reason why it did not translate into PFS or OS. Talking of the overall response rates in the ORRs, you find that although there is some benefit, but when you come to the actual hazard ratios, it was about 0.86. And that, to my point of view, would not be that significant if you have to call this as a practice-changing study, even if the trial is positive. So probably that is why, which Dr. Bhatt mentioned as the last line of the conclusion, that we're looking at other combinations of pembrolizumab with something else and olaparib with something else. So probably that's the reason why this study did not mature the way it was supposed to be. And we require good biomarkers to assist us in coming to a positive conclusion. So I think with that I'll conclude this. I thank Dr. Bhatt, and back to the organizers.
Thank you.
Thank you, sir.